Introduction to Career Exploration. This is lesson 1. Okay. You're at a place in your life where you're beginning to consider what type of career you want to pursue. This time can be both exciting and scary. Thinking about the rest of your life at your age can be a little intimidating, and you probably have a lot of questions. This module will help answer questions you may have about healthcare careers and careers in general. In this lesson, you will define passion, purpose, skill, and talent, identify advantages and disadvantages for a health career, determine workplace facilities for healthcare careers, and identify the 5 healthcare career pathways. How do you choose a career? It depends on what's most important to you. Some ideals you may want to consider before you choose are passion, purpose, skill, and talent. Ooh, got it. Passion is defined as any powerful or compelling emotion or feeling. Passion is what gets you going and what fuels you. If you can find or create a career that supports what you're passionate about, you will enjoy your work. Have you guys ever heard that saying where they say, find something you love and you'll never work a day in your life? That is passion. All right, purpose. Many people search for their purpose all their life. Your purpose is the reason you exist. Finding your purpose in the work you do every day can be extremely fulfilling and can help you understand your role in the grand scheme of life. Skill is the ability coming from one's knowledge, practice, and or aptitude. In other words, if you are skilled at something, you do it well. You can always work to improve your skill level. Talent is a special natural ability or aptitude. What talents do you have? Is there already a career field for your talent? If not, you could turn it into a career. All right, choosing a career. If you can choose a career that touches all 4 of these areas, you're really lucky. Consider which of these is important to you. Consider whether you can make enough money to live the lifestyle you desire. Do you like working with people? Does the sight of blood make you sick? Ask yourself these questions and be specific to the field which you are interested in. Don't feel rushed to make a decision, but work to identify what will help you live your best life.
So who gets sick when they look at blood? Anybody in here? No? Would you admit it if you did?
I would.
What about like needles?
Do you like it?
I like it.
Have you ever had blood drawn? Anybody in here ever had blood taken? No? Yes? Yes? Has anybody ever had like a broken bone? Yes? So you've been to like, have you had surgery before or just like a cast?
A surgery.
A surgery. What about you?
I just had a cat.
Just a cast. What about you? A cast. Okay. What about you?
Surgery.
Surgery. Okay.
But not from a broken bone, just like surgery to like younger.
So have you ever been around, like sometimes, and I think we'll talk about this in a little bit, but oftentimes people who are interested in healthcare have someone in their life, either a parent or a grandparent or an uncle or an aunt or a neighbor, someone that they're close to that either works in the healthcare field, or oftentimes someone who's been sick or had a lot of health problems, and that kind of fuels your passion for it because you see that and you want to be a part of that and help in that environment. So those are some kind of things to think about, especially, and we'll talk about that as we go along throughout this course, but those are those things that you think about, because I bet you each and every one of you has a reason that you're somewhat interested in the medical field.
So y'all last Thursday or Friday, you guys were listing careers in the medical field, right? What if you didn't really like blood? What's a job you could do in the medical field that would not put you around blood? Can you think of anything? If no one answers, I do know your names. I'm gonna call on you, just to let you know.
I don't know. I would answer.
Do you have an idea? If you don't like blood, what can you do?
No.
Is it everything has to do with blood, you think, in the medical field?
What did we talk about on Thursday where they have to do with pictures?
Like, what about like radiology?
There you go.
That's right.
Ultrasound, radiology, x-rays. What about a pharmacist or a pharmacy tech? They're really smart, they're good with numbers, maybe they're really good with chemistry, and they don't have a whole lot of patient care sometimes. So even if you're squeamish about shots or needles or scalpels or blood, there's different avenues, and there's things out there that you might not even know. So. Does anyone else have like a skill or talent that would make you good at something you're interested in? Or maybe like a life experience? Like you came up on a car accident, you did CPR, anything?
Obviously,
Exciting.
life experiences, because if football doesn't work, I wanna be a surgeon.
So what do you do in football that could help you with a career later on?
Probably leadership,
Okay.
like leading the team and stuff.
Handling a stressful situation, maybe handling, the coach is yelling at you, you're gonna have that, you're gonna have a boss someday, the coach is your boss.
Know what to do in the moment.
Yeah, that's really good.
Like when I was a little girl, I always wanted to put Band-Aids on everybody in the neighborhood. And my mom used to always laugh because somebody got a skinned knee and I would drag them home to my house and make sure that I put a Band-Aid on them and I scrubbed their knee and she was like, oh my goodness. But looking back on that, that is a passion that I had to care for other people. So those might be some of the little things that you may not even recognize about yourself yet, because you guys are pretty young. But those may be those things you may not even recognize yet, that you have talents and skills that you don't even realize.
All right. Advantages to healthcare careers. Great healthcare. One of the best parts of working in healthcare is having excellent insurance and benefits. If you work at a hospital, like we do, you kind of know everybody. So if we're ever in the hospital, you tend to see like someone you know, and you kind of feel like you get better treatment, but, yep.
Can I please get for my mom, Mr. Lindsay?
Helping people and the community. Working in healthcare, healthcare employees help patients and their families get through some of the most difficult moments in their life. In this field, you will contribute daily to the physical and emotional well-being of many people. Excellent career stability. Every city, every town, every village has somebody from in the medical field. So there's a plethora of jobs you'll never be without. Unfortunately, people always get sick. For those working in healthcare, that means steady employment and even some opportunities to gain more hours through overtime. In addition, there's also the ability to quickly move up in a career. Many career choices. Working in healthcare is such a growing industry that there are a vast number of specialties and/or departments to choose from. Even if you change your mind down the road, you can move to a different area of expertise without too much trouble or loss. Also, salary. All medical careers have very good and competitive salaries. Salary depends on the type of facility and the job title, but careers in the healthcare field typically pay well. The more education experience you have, the more you will likely make. Disadvantages to healthcare careers. Physical demands. Depending on the job you choose, you could end up spending lots of time on your feet. In addition, you may also have to lift and move patients. Long days in healthcare can take a toll on your body. There's also shift work. Hospitals and many other healthcare facilities operate 24 hours a day, 7 days a week, which means employees have to be there to care for patients all the time. This can make for 10 to 13-hour days, which includes weekends and holidays. And there's also exposure to germs. If you work in healthcare, you better take your vitamins. Employees are always exposed to other people's germs. Proper hand washing and safety precautions can help protect you, but sometimes germs go home with employees. Like, you must have a immune system of steel between here and the ER.
Yeah, you do. You're around germs all the time, but what do you think you get accustomed to doing all the time that helps protect you? What do you think I do all the time?
Wash your hands.
All the time. I'm constantly using hand sanitizer. I'm constantly washing my hands. Those kind of things. I mean, like the more you develop that habit of it, and that's part of what you do because it's part of, there's a lot involved when you get sick. Not only do you feel bad when you get sick, but you're missing work. You're putting your team because no matter where you work in healthcare, you're part of a team, and we'll talk about that as we go through this. But when I'm supposed to be at work, there's 6 other nurses who are there and a whole ER full of patients that we have to take care of. And if I'm out, guess what has to happen? Those other 6 nurses have more work to do, right? So it's very important. Same if you're a surgeon. If you're a surgeon and you've got a tummy ache that day, guess what? You've got patients who are waiting to have their surgery. They may have been waiting months for their surgery. So that doesn't mean you go to work sick, but that means you do what you need to do to keep yourself as healthy as you can so that you don't put the other people who are working around you either at risk or you don't make their work a little bit harder because, you're not there. So,
Do you guys think that there is a surplus or shortage of workers in healthcare right now?
Maybe a shortage.
You think a shortage?
A doctors and
Why do you think they're quitting?
Why? Because they're scared.
So what's happening in current events that would maybe cause a shortage of nurses and other healthcare people?
They're probably getting sick and then they have to stay home for 2 weeks and they don't wanna go back, so they quit because they're scared of catching it.
Yeah, and when COVID happened, maybe there's people kind of at the end of their career and they don't wanna risk it, so they started leaving. And even, new people or people going into, nursing school or whatever, they're starting to change their mind because it's kinda scary out there. And let's see, loss of patience. Sometimes healthcare employees can't help but feel fond of a patient. If and when a patient is lost, it can be hurtful to those who have taken care of that patient's needs. There's also a problem with difficult patients. From time to time, you have a difficult patient. Difficult can mean irritable, angry, aggressive, or uncooperative. The best thing to remember in these situations is you're there to help the patient no matter what, and you shouldn't take their behavior personally. Workplace facilities. There are so many facilities in which to work that we only have a few to cover on this page. So the biggest one is hospitals. That's what everybody kind of thinks of first. Hospitals are the most well-known employers in the healthcare industry. Whether it is with patients who have been admitted to the hospital or in the emergency room, there are many different healthcare roles housed at a hospital. It takes many qualified staff to keep a hospital running like a well-oiled machine. Does anyone know the largest employer in Lee County? Can you take a guess? Who employs the most? Lee Health, called Lee Health.
Oh, yeah.
Yep. I can't remember the number, how many thousands they employ.
It's a lot.
I wanna say there, I don't know, a bunch, like, I feel like there's over 100, well, I wanna say there's something crazy in the whole system, over 100,000 nurses, and that's just nurses.
Because there's not only just the hospital and health system, there's several hospitals, plus doctors' offices that are not even connected to the hospital, but they're related in their practice, so.
Who can name, let's do this really quick, who can name, there's 5 hospitals in Lee County, who can you name, anybody name one of them, 2 of them, 3 of them?
Okay.
Cape Coral Hospital.
Cape Coral Hospital,
Lee Health. The Trauma
Lee
Center.
Memorial Hospital,
Health.
Gulf Coast Medical Center,
My
Is
favorite
Health
one.
Park,
What's my favorite? Okay.
considered Lee Health?
yeah, so Health Park Hospital, so
and
that's
Children-
4.
I can't pronounce it.
Golisano.
Golisano, very good. So within our Lee Health system, we have 5 separate hospitals, all here within Lee County.
And then isn't there one coming up at Coconut Point, or is that just?
That is, actually,
medical center?
that one I'm not, like, it's a standalone ER, but it does have the capability, it's called Coconut Point, but I think it's got an actual,
No.
like, real name. But it does have a standalone ER, but it also has a surgery, like, capacity to do surgery, and I think at some point they will expand it and actually make it a small hospital too, so.
You only have one trauma center, right?
One trauma center in all of Southwest Florida, so the trauma center at Lee Memorial is the only one from Tampa to Miami. So, actually, that's not true, cause now there's one in Sarasota, there is one in Sarasota now. So, but anything from Sarasota south to Miami is all of our territory as far as a trauma center. So if there's a bad car wreck on Alligator Alley, or a bad car wreck in Punta Gorda, most often, they will come to the trauma center at Lee Memorial, yeah.
Great, workplace facilities, covered hospitals, there's also doctor's offices. There are fewer positions, found in most doctor's offices, however, those roles are important to aiding the doctor in caring for his or her patients. Medical receptionists for administrators, doctors, nurses, and billing and coding specialists are some of the employees that you'll find there. There's also diagnostic centers. Diagnostic centers are used for specific procedures such as MRIs, ultrasounds, and that sort of thing. Staff who work in these facilities typically have a specialized skill set. Elderly mental health facilities, nursing homes, and mental health facilities require quite a bit of medical attention. These facilities house a number of different healthcare careers. Special care is needed for these patients. And then there is in-home care. Home health aides, nurses, and physical therapists are health career choices that can make house calls for a patient. Patients who have been released from the hospital but need rehabilitation, or elderly patients that need someone to check in on them regularly are at the top of their list. Do you guys know anyone in the healthcare field?
Mom and Dad,
What's he do?
orthopedics.
Oh, okay, that's exciting. I bet every one of you can name someone that you know, right?
I'm fairly certain they can.
pathways. Careers in health sciences are divided into 5 categories or pathways: therapeutic services, diagnostic services, health informatics, support services, and biotechnology research and development. You will receive more information about each of these pathways unit of this module. Occupations are grouped by the common knowledge and similar skill set required within each pathway. You'll explore some careers and how they relate to the pathway in the healthcare career unit of this module. Let's see. That's it.
Yeah, alright, cool. So, this was just like an introduction, and so as we go through, we'll hit each one of those different career pathways, and talk about each one of them. There's one thing I wanted, where's that, okay, so here's what we're gonna do. I want you guys to get out your iPads and open up your iPads to, go ahead and sign into your module or to your system. And when you get there, you're gonna choose, when you get to your sign-on screen here, you're gonna go to the very bottom choice, which says Healthcare Exploration. Okay, you guys all here? No, not yet? Tell me when you are.
I forgot to save it. Isn't
Oh,
it?
that's okay. It's learn, I believe it's learn.aeseducation.com. Am I right about that? Feel like? It's kind of a running joke with my other class because I can never remember the name of the thing, and that's why I always say bookmark it, because they used to ask me all the time last year, and I'd be like, I don't remember. Because I bookmarked it and then I never had to look it up, so I forgot how to look it up. You guys got it? So when you get to the screen, I want you to click on Healthcare Exploration. Okay, and so you should then see it right up here, Healthcare Exploration module, and then you're gonna have units under there, okay? So what you're gonna do is you're gonna click on the first one that says Introduction to Career Exploration, and you'll see a screen that looks like this. Hang on a minute. That's what your screen should look like once you get in there, where it says, it'll have your units here, but then it'll have the one you opened up over here. Yes. Oh, good. Take a pre-test. Yes, you do have to take a pre-test. I forgot about that. How many questions is it? Might be 20 or so.
41.
Woo! 41 questions. Holy smoke. Okay.
Shoot.
Darn
I need
it.
to start it.
No, yeah, go ahead. Do it. I think it's good because that'll be good. It's actually good.
Yeah, that's what because I was back there, I was like, I don't know your plan.
Oh, no, I love it.
So where did I see pre-test?
So we don't see it because for some reason on ours it doesn't show that. I forgot about that. That is something. Maybe I'm gonna pause this. I'm gonna pause this for just a second.